Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video, we are going to talk about what to do if somebody is choking. Now, choking can be quite scary, but luckily there are some things that you can do to make the whole situation better. It happens when you've got something that's either partially or completely occluding the airway, and most commonly that tends to be something like food. In small children, it may actually be something that they've picked up and put in their mouth, such as a toy. First and foremost, we need to act quickly to assess the situation and decide whether this is mild choking, where you may have still an affected cough, or whether this is a severe case of choking, where the cough may be ineffective or the person may not be able to breathe. Exactly what you do depends on the age of the person involved, and it's generally split into those that are under 1 year of age and those that are over 1 year of age, including adults. Now, the first part of this video is going to go through what to do with any child that's above the age of 1 year or an adult that may be choking. In mild cases of choking, where the airway is only partially blocked, you may still be able to have an affected cough, and in those cases you should encourage the person to cough whatever it is out. If it's quite easy to get hold of and you see it in the mouth, then grab it and take it out. Otherwise, do not go fishing about, just in case you end up pushing it down further. In cases of severe choking, where the person may not have an effective cough at all, or may not be able to breathe, or may in fact be losing consciousness, you need to get some help. So call for the emergency services straight away. In the meantime, there are some things that you can do to try and encourage this person to clear their airway. Lean the person forwards and deliver 5 back blows. This is 5 sharp slaps on the back between the shoulder blades using the heel of your hand. After each back blow, check that the object that was causing the obstruction in the first place hasn't been coughed out. If 5 back blows are ineffective, then you need to actually move on to abdominal thrusts, or what we call the Heimlich maneuver. This shouldn't be used in children under the age of 1 year. Likewise, it shouldn't be used in people that are obese or maybe pregnant. In abdominal thrusts, you get the person to lean forwards and stand behind them. Place one fist just above their belly button in front of them and put your other hand over the top. And sharply and quickly pull inwards and upwards. Do this up to 5 times and make sure you check after each time to see if they've cleared the obstruction. If you've had to use the Heimlich maneuver or abdominal thrust in anybody, then make sure that they get checked over by a doctor afterwards. Now we're going to move on to what to do in children under the age of 1 year, and there are some slight differences. If it's a case of mild choking, again, lean them forward and encourage them to cough it out. Take it out of their mouth if it's easily accessible. In cases of severe choking, lay the child face down on your arm with the head tilted slightly downwards and deliver 5 back slaps between the shoulder blades using the heel of your hand again. And each time make sure you check to see whether they have coughed the object out. If that doesn't work, then you have to proceed on to chest thrusts, and we use chest thrusts in small children and not abdominal thrusts. In this instance, you turn the child over onto their back, again have them head down, put 2 to 3 fingers over their breastbone and deliver a sharp inwards and upwards pressure to try and get them to cough the object out. If you have had to treat severe choking in any child, then they should be checked over by a doctor afterwards, just in case there are any residual components left. Always remember, if you're worried about choking, get help early. And if the person continues to deteriorate despite repeated back blows and abdominal thrusts, or back blows and chest thrusts, then proceed on to CPR if you are indeed trained to do so. If they are not effective the first time round, then you can repeat sets of back blows and sets of abdominal or chest thrusts as required after that, in cycles of 5 as before. If the person continues to deteriorate and you are trained to do so, then proceed on to CPR. Otherwise, please call for help as soon as you possibly can. And that's what you need to do when somebody is choking.